My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Mwesigwa Joy, and I am your host. So in this podcast, we basically discuss health, all health issues. Actually, you can even feel free to comment what you want us to talk about. So we discuss preventive measures. What should you do when you actually have an illness? What are some of the complications? When should you seek for help? We just want to make sure that you're living a very healthy life and want to make healthcare accessible to you through these podcasts and through very many various ventures. So for those who watched the episode last week, we're talking about contraception with Dr. David, and we talked about the natural methods. Yeah. And we promise you that we'll bring him back again to talk about the artificial methods. Right. So if you have not watched the other episode, I would advise you to first go and watch it, understand what is contraception, what are some of the natural methods, so that at the end of both the episodes, you can make a very informed decision with your partner on what contraception method you want to use. Yeah. So we're going to dive into the topic right away. You're welcome again, Dr. David.
Thank you for having me again, Joy. And I would like to thank our lovely viewers who keep on watching and following our podcast to keep on learning about health. As we discussed in the last episode, we shared broadly about what contraception is. And I categorized contraceptive methods broadly into the natural and the artificial methods. So last time we talked about the natural methods. So today we are here to discuss about the artificial family planning or contraceptive methods. So these artificial contraception methods, we also categorize them into three categories. One, we have the hormonal methods. Two, we have the barrier methods. And then three, we have what we call the permanent methods. So hormonal, basically these include medicines. For people, I might not go so much into the science, but basically they are drugs that we have in different formulations to ensure that there is a way they tamper with our menstrual cycle such that someone does not conceive. For the barrier methods, it is always a way of how do we prevent sperms from reaching to an egg. Basically, we always look at how can we just prevent the sperms from reaching into an egg without tampering with the human cycle and so on. Then the permanent methods, these are the ones whereby we come in to ensure that someone does not conceive again. So under the hormonal, of course, we have a lot of things, that drugs, devices that we use. And these are always found in pharmacies, hospitals, clinics. So you have to seek attention of your healthcare provider to understand these methods deeply, and then you choose. So I will try to elaborate on some of them. Of course, starting from the more simpler ones to the more complex ones. So first, we'll start with what we call the birth control pills. Birth control pills are tablets that a woman is supposed to swallow on a daily, basing on how you've been advised. Because basing on the manufacturer's guidelines and the brands and so on, there might be a difference in how we swallow them. However, we swallow them on a daily. In these pills, we have the progestin only. Progestin is a certain type of hormone that we use when we are trying to prevent conception. Then we have what we call combined. Combined, those are ones that have a hormone progestin and then another hormone called estrogen. All of them have a way of how they interfere with the gonadotrophins. They affect the release of the follicle stimulating hormone, the luteinizing hormone, and eventually what we are always looking at is either to delay or to stop ovulation. So I might not go into the deeper science, but that is how they work. That is the mode of action. Give these hormones, they interfere with the natural process of your menstrual cycle such that either ovulation is delayed or it is stopped. However, when we read also deeply on how these birth control pills work, some of them have, it's more of like a side effect, but then it helps in preventing contraception. Majority of the hormonal methods that have progestin, they make the cervical mucus to become thick. If you remember when we are talking about the natural methods of cervical mucus monitoring, we said when you're in going to your ovulation or in the fertility days, the mucus becomes very thin. Then when you're not, it is thicker. So these methods, the progestin releasing methods, they always make our cervical mucus to become thick. And once it is thick, there is a way it tampers with the penetration of sperms from the vaginal canal into the uterus. So the sperms take longer time when they are trying to penetrate the mucus, and by so doing, the 5 days and so on elapse, as also the other process of delaying ovulation is also taking place. Another thing is also more of like a side effect, however, it also helps prevent conception, is that they make the membrane of the uterus, or what we call the endometrium, to become thin. And once this membrane becomes thin, even if by chance someone maybe conceives, there is no way that pregnancy or the fertilized egg is going to get implanted onto a thin endometrium. Maybe what I didn't mention, these artificial family planning methods are effective, and we always rate them accordingly, but most of them score above 95, apart from other factors remaining constant. However, of course, there is that loophole, the 5%, that there are chances whereby someone has used these methods and they have conceived. However, as I've been explaining, that most of these hormonal methods that contain progestin have that mechanism of action whereby the ovulation is either stopped or delayed. Then the cervical mucus membrane becomes thicker, and then also thinning the wall of the endometrium. Another hormonal method that we
Before
have.
we go to another one,
Yes,
about
please.
the pills. Most ladies fear using the pills because of fear of infertility. Like we have talked about how the endometrium has become thin, some hormonal changes, and then the thick mucus. What if a lady uses these pills for a long time? Like maybe someone starts having sexual intercourse like campus at 20, and then they get married at 30. So they have used pills for 10 years. Yeah. What is there a possibility of infertility? And what if the body gets adapted in that even if you stop taking the pills, your endometrium fails to recover since it has been thin for a long time, or you have hormonal imbalance? Yeah.
So it's a question that is always asked, and sometimes medically we tend to call it sometimes a myth that family planning or these contraceptives lead to infertility. Of course, there could be a little bit of what we call secondary infertility, but with time and with proper intervention and health-seeking behaviors, what we would term as that infertility can always be corrected. Then maybe also going back, we always advise people that before you go for this family planning or this contraception method, please go and ask your healthcare provider. We will advise you on how long would it be suitable for you to use a certain family planning method. And in certain cases, we could even discontinue and advise you, okay, we've used these pills maybe for 3 or 4 years. Can we please try to switch to another family planning method that could have maybe lesser side effects compared to this? But of course, as you said, that prolonged use can come in with what we would call infertility and so on. But all those can be corrected if you seek healthcare. Of course, with checkups, with proper consultation, they get to see what are you experiencing. We run some tests, the hormonal tests, the fertility tests, and then they can always be corrected. Yes, please.
Okay. So what are some of the other hormonal methods that we could use?
Yeah. So other hormonal methods, we have what we call the injections. They have very many types. Of course, some women know Cyana, there is Depo-Provera. So these hormones, these injections also contain the progestin hormone. However, it is of course a slow release compared to the tablets. And these will help prevent the ovulation within that period. The most common ones that we have on market always go for 3 months. Those are 90 days. And after that, you're supposed to get another injection if you are still interested in preventing conception. But if you're not interested, then of course at that expiry, you just discontinue and you could be ready to conceive. Another method that we go on is what we call the implants. Implants, of course, we also have different brands, Jadel, Implanon, and so on. Of course, now those are for us, the healthcare practitioners, to understand and advise you on which one we can use. The implants we can always use for 3 years, and then we also have those that go up to 5 years. So an implant, it involves inserting somehow like a plastic rod, but when it is containing drugs or the hormone progestin under your upper arm, and we keep it in for the specified period as you discuss with your healthcare provider. So it's also slow releasing. It keeps on releasing a specified amount of the hormone progestin, which helps us in preventing or delaying ovulation until when maybe you feel like I really need to conceive, and it can be removed. We always advise that if you've put in the one for 3 years, the moment the 3 years elapse, please go and remove it. We always say avoid delaying to remove, because the more it delays, it becomes expired. The way tablets will be expired when you read at the expiry date. So once those 3 years elapse from the time of it was inserted, it has become expired. You can remove it. If you still want to continue, you can either insert another one, or you can discuss another family planning method. Yes, please.
Okay.
Any question before we proceed? So another hormonal method that we use that is currently on the market is what we call vaginal rings. These vaginal rings also have a hormone progestin, and they are inserted inside the vagina. Usually it is advisable to insert them on day 1 of your menstrual cycle for it to be very effective. That even immediately after your menstrual period, the menstrual bleeding, you're already protected. However, for women who are so sensitive and so on, and they don't wish to insert it when they are menstruating and prefer to insert it after their menstruation days, we always advise for the first 2 to 3 days to use another alternative family planning method, either withdrawal or condoms, because it is medicine. It has to be released, and there is a time it has to take for it to start being effective. So you might say, they said I can use the vaginal ring. So for you insert it after what? After your menstruation, and you maybe you delay to insert it, and then you conceive and you say the ring doesn't work, but just because maybe you didn't take enough precaution. Yes, please. Then we also have what we call the contraceptive patch. So the contraceptive patch, for it is more of like a sticker that we attach to our body, and it has a hormone. You just attach it to this.
I attach it when?
We attach it to the skin. Usually the preferred places, it's either the upper arm, we can use the buttocks, and then also we can use the lower abdomen. We always want to have it attached to a place whereby it won't be removed easily, because as you know, we just attach it to the skin. So if at all it is in a place whereby there is always a lot of friction and so on, it can easily move off, and it interferes with the contraceptive ability. So this patch, we always advise to use it. The moment you see your periods, you put your first patch. It works for 7 days. After the 7 days, you remove, you put another patch. After another 7 days, you put another patch. If your cycle is regular, that is for 28 days, we always say we use 3 patches. Then what would have been the 4th patch, we are supposed not to put a patch such that you see your periods. If you instead put the patch, you might find yourself missing your periods, and then now you'll have another trouble of now starting to track your days again. Yes, please.
So for the patch, I think someone could be wondering, do I find off showering with it? Like when I put it for the 7 days, I leave it there?
Yes, please. When you put it, it stays there on your body for the 7 days until the 7 days elapse and you have to replace it. The only other instances whereby maybe that patch should be replaced, that is if at all you find yourself in a situation and it has been removed accidentally. We always advise the moment it is removed or tampered with, you always find a way of replacing it immediately.
Okay. So I think now we could dive into the barrier methods, right? What are some of the barrier methods that we could...
Before we go there, there is something interesting that I would like also to talk about.
Okay.
Sometimes it is not regarded as a contraceptive method, but it is in actual senses, is what we call the emergency pills. When you sometimes we are listing the contraceptives, we don't list it, but it is because people use it, and then also sometimes other people end up even misusing it. So emergency pills or after sex pills, these are pills whereby someone we use to prevent contraception after having unprotected sex or after having a failure of one of the methods that we are using. Let me give an example. Someone was using maybe, let's say, condoms, and the condom burst. You have to look for an alternative to be safe. You're going to go and use the emergency pills. If maybe someone was using the withdrawal method, accidentally or unfortunately, the husband fails to remove the penis at that time of ejaculation, will you just say, okay, let me just conceive because it has happened? If someone is not willing to conceive, we can always use the emergency contraceptives. However, we always advise people to use them with caution because as you hear the word, it's an emergency. So we are not supposed to use them very often or repeatedly because there are a lot of side effects that come with misuse of those emergency contraceptives. And then there is a question that is being asked. Doctor, I used my emergency contraceptive very well, but then I conceived. This brings us to how these emergency pills work or their mode of action. Their only mode of action is by delaying ovulation. They don't stop ovulation and they don't interfere after ovulation has occurred. So we advise that if you are to use an emergency pill, be sure that it will be effective if at all you've not yet ovulated. That is maybe day 10, day 11, day 12, and maybe day 13. Once we reach day 14, day 15, and day 16, the emergency contraceptive will not help you. That is whereby it is a very big question nowadays. I took my morning after pill, but then I conceived. So these emergency pills, they don't work. They are fake. What? Some people even tend putting such blames on some specific brands. But yet it's not the brand. It's because someone took it at a wrong date whereby it can no longer help them. Yes,
okay,
please.
so you talked about the fact that some of them, that they have side effects. So what are some of the side effects that someone could experience from emergency pills?
Of course, the most usual side effect is that you will bleed not when you expected. So either before, some people find that you're bleeding before your actual periods, and then others, the periods can be a little bit delayed, maybe for another 1 or 2 weeks. Other people, even after this bleeding, they start getting spotting in between their menstrual periods, but when it is an effect of the emergency pill. Another thing, it can alter with how you've been experiencing your menstrual blood. To some people, they start experiencing heavy and sometimes with clots, yet it has not been happening before. So those are some of the most usual side effects. Then there are others which vary from person to person, like nausea, vomiting. To some people, even they get what we call the pregnancy signs, early pregnancy signs. Someone feels the morning sickness, but just because it is an effect, a side effect of the emergency pill.
Lastly, about the emergency pills, when does it become misused? Like, for example, like at what point do we say that this person has overused or misused emergency pills? Like, how often? Okay, I think I can't say how often, but you understand what I mean. At what point does it become misused?
We would advise, for the sake of your reproductive health, at least a woman should use an emergency pill once in a quarter. A quarter, that is a period of 3 months. However, we would even say twice a year should be the maximum. But you find yourself someone is using these emergency contraceptives almost each and every month.
There's a video that was saying ladies use it as a Monday morning chocolate. Like after the weekend, Monday, emergency, next Monday again.
So that is already misuse. If you find yourself using these emergency pills more than once in a quarter, please, you're advised to look for another alternative family planning method. Yes, please. So we can proceed to the barrier methods. As I talked earlier, this is whereby we are trying to prevent sperms from meeting with the egg. We are not using hormones this time around to interfere with the woman's cycle. However, we are putting in place devices or mechanisms to ensure that the sperm doesn't meet with the egg. The most rampant used barrier method are the condoms. We have the male condoms and then the female condom. Though female condoms are very scarce and very rare. Actually, there is a training we are in and we are still talking about. Of course, we are dealing with how to prevent STDs, and a topic about condoms came in the room whereby we are about 200 medics. We found ourselves that only 10% knew how to correctly use a female condom, just because it is rare. However, they are an effective way if properly used, and once you determine that the condom is also in good shape, that is, if it is not expired, it doesn't have any holes and leakages, it is well lubricated, all those are factors that determine its effectiveness. Another barrier method that we can look at, we have diaphragms. Diaphragm then also have cervical caps. They are almost the same. They are like cup shaped, and a lady is supposed to insert it inside to cover the cervix before sexual intercourse. So this helps prevent the penetration of sperms through the cervix to the uterus. Once properly used, they are always an effective method, though of course they can come with discomfort, interruption of the sexual pleasure. Maybe once your spouse gets to know you've inserted something and without their consent, or even sometimes when they know there is something, sex is purely a mental game. So if someone knows maybe you are just having it, can interrupt with that pleasure. Then also in the barrier methods, we can have what we call spermicides. Spermicides are more of like gels, they are like tubes. Some of them are always used in combination with the diaphragms and the cervical caps. Someone inserts it and then they smear that spermicide gel around it. These spermicides, for them now, they just come and they affect and they weaken the sperm such that they die off earlier, and then the body will absorb them. Then we'll talk about the IUDs. So these IUDs, they fall into 2 categories because we have basically 2 types. We have the hormonal IUDs. Then we have the non-hormonal. Of the hormonal, I have, unfortunately, I didn't discuss it in the hormonal methods, but there are those hormonal IUDs whereby their mode of action is that they release progestin that then has the mode of action like all other hormonal contraceptives. Delay ovulation, make the wall thin, and then the side effect of progestin of making the mucus thick. But then we have the non-hormonal IUD. Usually, commonly we call it the copper IUD for in layman, such that people understand. So it has that copper that helps try to weaken the motility of the sperms such that they don't move swiftly to interact with the egg that is within the fallopian tube. So it is those IUDs, they are always in T shape, and of course it is inserted by a healthcare professional such that it prevents the penetration of sperms from the uterus to the fallopian tube, whereby they have to meet with the egg.
Okay.
Yeah.
So about the IUDs, some ladies fear using them because they believe that it could get lost in there, or also they believe that it's associated with infections most times. So is that, how true is that, and is it a reason to fear them?
Of course, every method that we've talked about could be having side effects. However, there are also what we call myths. So if someone is associating IUD with infection, they could be right if they are associating it. However, the myth that is there is that IUDs cause. IUDs don't cause infections. However, they could be associated. I'm going to explain how it comes. If at all an IUD is inserted, and at that point of insertion, a woman is having a UTI or a urinary tract infection, there is a possibility that this infection could be transported in the process of insertion from the vaginal canal to the fallopian tubes with the IUD. So in such instances, that is whereby we are going to have that high tendency of the PIDs, there is salpingitis, endometritis, and that is the biggest occurrence. That's why people always associate IUDs with infections. However, for proper insertion of those IUDs, we are always advised, you go to your healthcare provider, they screen you for those STDs, for the UTIs. If at all you found having one, at least it's advisable it is first treated before insertion, such that we avoid the transmission of the infection by the IUDs. Secondly, you see, whenever you're having a device inside of you, you're always so skeptical. Is it still in position? Is it still in place? So we find ourselves that most women always try to check, to touch those strings to see that, hey, is it still in position? In some cases, you're going to find that your hands are not 100% clean. They will be having germs. So the strings will become like a point of attachment, and then the germs will be spread. Remember, these germs, some of them are normal in other cases, others are abnormal whenever they move from a different part of the body to another one. So they become disease-causing germs in those cases. Yet in other places, they would have been normal, or what we call the normal flora. So those are some of the cases as to why someone will associate IUDs with STDs and infections. In other cases whereby we've seen IUDs having a high prevalence of infection, this is whereby someone is now having multiple sexual partners. So it is not the IUD itself, but the act of having sexual intercourse with a number of people. So these strings will be moving different organisms from your different sexual partners, and hence you'll be having the recurrent infections. Yes, please.
Okay. So I think lastly, we will proceed to the permanent contraceptive methods.
Yes.
Yeah. What are some of those?
Permanent contraceptive methods, basically they always talk about two. That is tubal ligation and then vasectomy. Tubal ligation is whereby we come with a medical personnel, usually gynecologist, and they cut the fallopian tubes, hence removing the connection between where the eggs are produced from to where you can conceive and maybe where the baby can grow from. They can always do just a cut and they just separate or they tie the tubes. However, in other cases, they can cut the tube and they remove it permanently. We call them permanent because in most cases, they are irreversible. However, in some few instances, especially if at all the tube is not removed completely and it is just tied, there could be a reversal. But it is very costly, and then it is a try and error with a chance of 50-50 for you to conceive or not. Then another method that is vasectomy, and that is done to men, whereby we always cut the seminal vesicles, the tubes that transport the sperms from the testis then to the urethra. So we just cut them and then the man will not be in position to impregnate a woman. However, in layman's language, you always say, a man, once you have vasectomy, please inform your wife, because there is a chance that your wife will continue to conceive even when you are unable to impregnate her. Then, I personally, apart from those two methods, I always add another method, and that is what we call hysterectomy. This is if maybe a woman has issues and complication and we are supposed to remove the uterus. Of course, there is no way a woman will conceive. Though it is not something that is so common, but it can happen in those rare cases. Of recent, through practice, we've started seeing women who come and request for it. Someone has maybe 4 kids, 5 kids, doesn't want to go to family planning, or maybe because of their past experiences, or because of the myths they have, or because of the experiences of their friends, will tell you, doctor, since I have my 4 children or 5 children, please you remove the uterus. Yeah.
Okay, so as we come to the end of the episode, maybe I would pose a question about which of the all the artificial methods you have mentioned, which one is there one that is more recommendable? Like, is there one that's maybe more safe or mostly used, or that has less side effects? Yeah, if someone wants to choose out there, because we've talked about many, is there one that's a go-to, or all of them are as effective as each other?
Of course, the level of effectiveness varies from family planning to another. One, all those hormonal family planning methods don't have the same dosage of the hormones. The dosage always varies. And through the interaction with your healthcare provider, they will advise you that you use a low dose, medium dose, or high dose. However, the choice of family planning method for you to use depends on a number of factors, even putting aside the side effects. First of all, your healthcare provider will do a background health check. Are you having hypertension? Are you diabetic? Are you having any blood disorders? Are you having any heart issues? Are you having any cancers? Are you taking any medications? There are drugs that affect the effectiveness of some family planning methods. So for you to choose, it's always a step and a guidance with your healthcare provider. However, personally, as a healthcare provider, of course, I also have a family planning method that I always advise most women, regardless of other factors, if at all those factors are not so much into play. And that is the non-hormonal IUD. One, it is going to stay in your body for a very long time, because you can use that non-hormonal or the copper IUD for up to 10 years. So you're not worried that I have a time limit of maybe 3 years or 2 years to worry. Secondly, since it is not in any way interfering with your menstrual cycle, we are 100% guaranteed with your fertility that anytime we make a decision to remove it, even if it is today and you are in your ovulation, the chances of you conceiving are at around 98%. And then also, if you're screened very well for the STDs and UTIs, it is associated with the lesser side effects compared to other family planning methods. Yes, please.
Okay, thank you so much, Dr. David, for educating us about the artificial methods. So I'd like you to maybe give the closing remarks to our people in regards to the topic of contraception. Yeah.
Thank you very much, our viewers, for following my doctor podcast. And thank you very much for coming here to learn more about contraception. So as I've discussed about contraception entails a number of factors and considerations that you're supposed to put into place. One, first of all, your health as a person. You have to first understand how your body is, how your cycle is, and then how you respond maybe to a number of drugs and other chemicals. Secondly, we always advise people, and this is a very common challenge we've interfaced. Most women come to choose family planning methods without involving their spouses. We always advise that it should be very thoughtful if at all you involve your spouse, because they can be supportive in this event of trying to conceive. And if you have a challenge of convincing them, please take them to a healthcare provider who shall try to convince them with health facts. Then another thing that I would always advise, try to avoid as much as possible to get a family planning method just over the counter without first interacting with the healthcare provider, because they have a number of side effects, a number of challenges, and our bodies, of course, are suitable for different family planning methods. Thank you very much.
Thank you so much, Dr. David. I hope our audience has learned about contraception in a broader perspective, and we hope that you'll make the right decisions. We have seen so many methods. Emergency pills are not safe if you use them frequently, so you should visit a healthcare worker and find out which method will work best for you. Thank you for watching this episode. My name is Mwesigwa Joy and I'm your host. This is the My Doctor podcast. My Doctor, your health anytime, anywhere.
My Doctor, your health anytime, anywhere.